Hello, I am George. Welcome to George Tech's on Health. Today we'll learn about the study shows that the most common bacterial strains among the samples were Firmicutes, Bacteroidetes, Proteobacteria, and Actinobacteria, while the most common genera were Streptococcus spp, Prevotella spp, and Staphylococcus spp. Was identified by researchers at Karolinska Institutet in Sweden. There haven't been many such studies, so the team hopes this one can shed more light on the relationship between oral bacteria and other conditions. The research was written in Microbiology Spectrum. Previous research has shown direct links between dental health and common diseases such as diabetes, cancer, cardiovascular disease and Alzheimer's. However, few longitudinal studies have been conducted to determine the specific bacteria present in infected areas of the mouth and jaw. The most prevalent bacteria were identified following an analysis of samples collected from patients with severe oral infections between 2010 and 2020 at Karolinska University Hospital in Sweden by researchers from the Karolinska Institute. This was a joint study conducted by Professor Margret Salberg-Chen and the research groups of Assistant Professor Volkan Özensee. We report here for the first time the microbial composition of bacterial infections from samples collected over a 10-year period in the province of Stockholm, says Professor Salberg-Chen from the Department of Dentistry at Karolinska Institutet. The results show that several bacterial infections associated with systemic diseases are persistent and some have even increased in Stockholm over the past decade. A role in other diseases. The study shows that the most common bacterial strains among the samples were Firmicutes, Bacteroidetes, Proteobacteria, and Actinobacteria, while the most common genera were Streptococcus spp, Prevotella spp, and Staphylococcus spp. Our results provide new insights into the diversity and prevalence of harmful microbes in oral infections, says Professor Salberg-Chen. The finding is not only important for dentistry, but also helps us to understand the role of dental infections in patients with underlying diseases. When a particular bacterium infects the mouth and causes damage, it is very likely to damage tissues in other parts of the body as the infection spreads. In the pancreas reflects the severity of pancreatic tumors. The study was conducted with 1,014 samples from as many patients, of which 469 were women and 545 men, and a mass spectrometry method called MALDI-TOF quickly identifies individual live bacteria in a sample, but that's rarely used in dental care. PGT, our study was a single-center epidemiological study, and to ensure the validity of the results we need to do more and larger studies, says Volkan Özensee of the Department of Laboratory Medicine at the Karolinska Institutet. We now hope that dentists will collaborate more closely with clinical microbiology laboratories to gain a better understanding of the bacteria that cause dental infections in order to improve the diagnosis and therapeutic management of oral infections. Thank you for watching. Please subscribe.